No doubt you've seen the news stories involving breaches with thousands of patients related to large group practices, hospitals, and insurance companies. Does it seem like the size of those breaches may not be relatable to your practice? Maybe you don't have that many patients in your practice, for example. Yet it begs the question, how would you manage a breach if it was just a few patients or maybe even one patient? What would you do? Well, it's important that you rely on the 4-factor breach assessment that's laid out under the Omnibus Rule and the HiTech Act. Because while the HiTech Act requires that you notify patients of breaches, the Omnibus Rule redefined that. So the threshold is a little bit more stringent now, or a little bit more higher, you might say. For example, it's presumed to be a reportable breach unless you can show through that 4-factor breach assessment that the risks to the patients are low. But the important thing to remember is even if the risk is low, how do you manage it internally? Meaning, how do you do the right thing? What should you do? Should you ignore it? Should you hope it goes away? Well, first and foremost, what happens let's take a few examples. What if you send the wrong x-rays to the wrong patient? Or what if you get treatment plans mixed up so that 2 patients get the wrong treatment plan? How do you go about doing the right thing in those circumstances? Well, first you wanted to retrieve the information if possible. Get the information back that you sent that was incorrect. Then notify the affected patients. Perhaps you would need to do an apology or explain to them what happened. And last but not least, it's important to do a refresher training for your staff so you can help them to remember the best practices for preventing those kinds of hiccups happening in your practice.